Hi everyone. All right, so today we're going to start talking about teamwork and how it relates to quality, which obviously there's a whole big piece on that. So, objectives, we're going to identify current healthcare systems and how lack of communication and collaboration is affecting the patient. We're going to define communication, collaboration in the healthcare system, and we're going to identify barriers to communications and collaboration. And then we're going to describe ways communication and collaboration can assist in the development of an effective team for the safety of the patient. So today's healthcare setting, communication and collaboration and teamwork do not always occur in the clinical setting. We all know that. Social, relational, and organizational structures contribute to communication failures. Organizational structure is a large contributor to adverse clinical events and outcomes, and priorities of patient care differ between members of the healthcare team. So all that put together, right? So we have social issues, relational issues. I'm mad at this person. I don't like her. Organizational structure. I have no one to report to who's going to listen to what I need. There's literally a lack of way for me to communicate what's going on. And then the organizational structure is actually one of the larger contributors. So today's healthcare system involves numerous interfacing and patient handoffs among multiple healthcare workers with various training and education level. In clinical practice, many instances where clinical information must be accurately communicated. So team collaboration is essential. When healthcare professionals are not communicating effectively, patient safety is at risk for several reasons. Lack of critical information, misinterpretation of information, unclear orders over the telephone, and overlooked change in status. During a 4-day hospital stay, a patient may interact with up to 50 different employees. So imagine that. More than 1/5 of patients hospitalized in the United States reported hospital system problems, staff providing conflicting information, and staff unsure of which physician is in charge of their care. So that's also really confusing, especially when there's multi-problems for the patient. So here are some studies that looked at physician and nurse disruptive behavior. You can see all these incidences. Disruptive behavior is defined as any inappropriate behavior, confrontation, or conflict ranging from verbal abuse, physical, or sexual harassment. So let's bridge the gap. Teach communication techniques and tools available for effective communication. We need to build collaboration and effective teams through role clarity. Review process, so if there is a lack of communication and collaboration, patient care is not effective. And we need to build a culture around collaboration. So definition of communication. Imparting or interchange of thoughts, opinions, or information by speech, writing, or signs. 93% communication is nonverbal, which includes body language, attitude, and tone. And a lot of people will take tone the wrong way, and 70% are words that are actually said. Spoken words contain crucial content. Their meaning can be influenced by any style of delivery. And sometimes people say, she was so rude over email. And I'm like, how? How did you know? There's no tone. Of course, now that we use more and more electronic communication, you can kind of get an idea of tone, but still, it's really confusing. What does lack of communication cause? Medical errors, especially those caused by failure to communicate, are a pervasive problem in today's healthcare organization. According to Joint Commission, medical errors appeared on the National Center for Health Statistics list of the top 10 causes of death in the United States. They would rank number 5 ahead of accidents, diabetes, Alzheimer's, as well as AIDS, breast cancer, and mortal gunshot wounds. 44,000 to 98,000 people die every year in the U.S. because of medical errors in hospitals. Even more disturbing, communication failures are the leading root cause of any sentinel event. According to Joint Commission, more specifically, the Joint Commission cites communication failures as the leading root cause for medication errors, delays in treatment, and wrong site surgeries as the second most frequently cited root of operative and post-operative events and fatal falls. So I guess it's clear why healthcare workers are requesting ways on how to improve communication. So what does lack of communication cause? Faulty and incomplete exchange of information, professionals ignoring potential red flags and clinical discrepancies, create situations where medical errors can occur. These errors have the potential to cause severe injury or unexpected patient